Today we're diving into something that sounds like it was pulled straight from a sci-fi movie, using AI to predict our health decades down the line. So let's start with a question that's, pretty personal. I want you to think about your entire medical history, every single checkup, every prescription, every diagnosis. Could all of that data actually be used to forecast what health issues you might face, say 10, 15, or even 20 years from now?
Well, get this. The answer might actually be yes. A team of scientists from the European Molecular Biology Laboratory and the German Cancer Research Center has built a pretty incredible new AI tool that's designed to do exactly that.
So what exactly are we talking about here? Is this some kind of digital crystal ball for our health? Let's break down what this new model is actually capable of.
Okay, so at its heart, it's a generative AI, similar to the technology that powers tools like ChatGPT. But instead of learning from words and sentences, it learns from health records. It's built to sift through a person's entire medical history to forecast the potential risk and even the timing of over 1,000 different diseases, more than a decade before they might happen. And just to show this wasn't some small-scale test, the researchers threw a massive amount of data at it. We're talking about health records from a staggering 1.9 million patients in Denmark. This is genuinely one of the biggest demonstrations we've ever seen of how AI can model human disease on this kind of scale.
All right, so how on earth does it learn to make these predictions? Well, the way the researchers explain it is really fascinating. They talk about something they call the grammar of health. Let's dig into what that actually means.
Think about it like this. A large language model learns grammar, right? It figures out the patterns that tell it how words should be ordered to make a sentence make sense. This health AI uses that exact same logic, but for our medical lives. It learns the typical order of events, diagnoses, treatments, lifestyle factors, all of it, to basically understand the story of a person's health from beginning to end.
And hey, don't just take my word for it. One of the lead researchers, Moritz Gersting, puts it perfectly. He says that just like a language model learns sentences, this AI learns the grammar of health data. It's all about spotting those crucial patterns over time.
But this brings us to a super important point. This model is not handing out a definite, set-in-stone diagnosis from the future. It's absolutely crucial to understand that we're talking about probabilities here, not certainties.
You know what? The best way to think about it is like a weather forecast. A meteorologist might tell you there's an 80% chance of rain tomorrow. They're not promising it's going to pour, but they're giving you a really good risk assessment based on all the data. This AI does the same thing just for your health.
So to make this a little more real, let's look at a concrete example from the study itself, figuring out the risk of a heart attack for men in a specific age range.
And this is where you can really see the power of the model. For men between 60 and 65, the AI was able to identify these wildly different risk profiles. So a low-risk person might have a 4 in 10,000 chance of a heart attack in the next year. But for someone with a high-risk history, that risk skyrockets to 100 in 10,000. That's a 25 times difference that the AI was able to spot.
But right after we see a dramatic number like that, it's so important to ground ourselves. Another researcher on the team, Tom Fitzgerald, really emphasizes this. He says, crucially, this is not a certainty, but an estimate of the potential risks. It's a tool for understanding risk, not a crystal ball for predicting your destiny.
And look, like any new technology, this model has some pretty big limitations. The researchers are very clear about this. It is absolutely not ready for clinical use. For one, the data it trained on was mostly from people between 40 and 60, so it's not as accurate for younger folks. The data is also from a specific population, so we don't know how well it would work for others. And of course, it's not great at predicting completely unpredictable things like catching an infectious disease.
So with all those caveats, you might be asking, what's the big deal then? What does a technology like this actually mean for us and for the future of healthcare?
Right now, its biggest impact is as a research tool. Scientists can use it to get a much better picture of how different diseases develop over a lifetime. They can explore how things like diet or smoking really impact long-term risk. And what's really cool is they can even use it to generate artificial patient data to study rare diseases where real-world data is hard to come by.
So what would it take to get something like this into your doctor's office? Well, it's a long road. It's going to take a lot more testing and validation, a huge effort to address the biases in the data, and of course, creating entirely new rules and regulations to make sure it's used safely and ethically.
So here's the bottom line. No, this isn't ready for your annual checkup just yet. But what it is a profound proof of concept. It shows us a completely new way to understand how our health unfolds over time. And it really makes you wonder, doesn't it? Could we be looking at the very beginning of a true revolution in preventative medicine?